Hi everyone, this is Dr. Sivakumar, Consultant Vascular Endovascular Surgeon at Care Hospital, HITEC City. Today we will discuss about varicose veins. So what are varicose veins? These are abnormally dilated veins. Why do they occur? When, where do they occur? They occur commonly in the legs. We can see bluish or very large veins in the legs. And also some people may present with pain or else any pigmentation as blackish discoloration in the legs. So are the varicose veins dangerous? No, varicose veins are not dangerous, but there may be some problems that are associated with varicose veins like skin pigmentation, ulceration and also vague pain in the legs. Very few cases may present with a bleeding and clots. So why do these varicose veins occur? It occurs due to prolonged sitting and prolonged standing. It may occur due to some other problems due to secondary to venous thrombosis. So mostly it occurs due to prolonged sitting and standing. Our body is made to walk and the calf muscle acts as a pump which pushes the blood from the legs to the heart. So when we sit for a prolonged time or stand for a prolonged duration, it causes the blood to stagnate in the legs and it causes problems in the veins that may lead to varicose veins. So how do you prevent varicose veins? We can prevent varicose veins by walking whenever possible and avoid sitting for longer periods and doing foot tiptoe movement so that the blood pumps back to the heart, and also elevating the legs to the level of by keeping a chair or a sofa in front. So these things will help in preventing varicose veins. So how do we know whether we have a varicose veins or not? If you are suffering for any pain in the legs or any skin discoloration or visible veins in the legs, you can consult a vascular surgeon. We can assess you and give you the exact diagnosis whether you have a varicose veins or not and how severe it is and whether you need a treatment or not. So what are the treatment options available for the varicose veins? We have open surgery, and which is older and which we don't do it now, and we have some advanced surgeries like laser surgery for varicose veins. It's endovenous laser ablation or endovenous dermal ablation, and we have newer modalities of treatment like glue therapy. We can treat you varicose veins without cutting your body. So how many days it may take for you for getting relieved of these varicose veins? It's simply a day care procedure. You can go home on the same day. You can be relieved of your pain or stress. Thank you.